the process of bringing life, it's an exciting journey which can be properly managed. Right, moving on. So we are first going to be talking about the myths of pregnancy. And, we were able to gather a lot of things that different people have said about pregnancy, but we are going to be picking just a few to save our time this evening. So the first one and the commonest one is morning sickness. Morning sickness occurs only in the morning. Well, despite the name, morning sickness, it can affect pregnant women throughout the day. Morning sickness, these are the symptoms of nausea, the feeling of vomiting, or even vomiting itself, body weakness, and loss of appetite and all these things. That's morning sickness, and it is common for pregnant people to experience, especially in their first trimester. So it starts around the fourth and ends at the 16th week. So the myth is that it usually occurs in the morning, but that is not completely true. There are some people that this this sickness can extend even throughout the day. It can extend to the afternoon and can go even through the night. So it's not just for morning and it's usually thought of. So I'll move on to the next slide. All right, so the second myth, I believe every one of us has had it. Please, can you hear me? If you can hear me, please just give a response. Hello?
I can hear you.
All right.
Anyone in the audience can also give a response. If you can hear Dr. Yomi, please give a response.
Are you following? Can we move on?
You can unmute to give a response, please.
All right, someone said, Elizabeth said, yes, we can. Taiwo Ashipa, yes, we can. All right, so let's move on.
Okay, good. Let's move on.
So the second one, which are it's for two, which is quite funny, it's for two and all. Well, not necessarily, you don't need to double up your feeding because you're pregnant. In fact, most of the time, you don't even need an extra calorie until your late pregnancy. So, though there's this possible increased appetite, do you understand? But most of the time, it's more of frequent eating, not as compared to larger volume. So it's more of eating frequently, possibly smaller jumps. So you don't necessarily need to double up your calorie. In fact, you may need to just as little as 250 calories, and we are going to look 250 is like maybe like two noodles, you understand, per week. Do you understand? So that's in the second trimester, and then extending it to the third trimester, it might go as much as 50, like possibly about 3 to 4 noodles per week. So it's not much of a big. I don't know if you understand what I'm saying. So that is not completely true. Moving on. So the third myth is that don't travel while you're pregnant. All these myths just Nancy fearful. Makes us scared. Oh, I can't live my life when I'm pregnant. I cannot do this. I can't do that. It's not absolutely true. You understand? You can travel when you're pregnant, but we don't advise traveling when you are late into your pregnancy. So I said you can travel as much as 36 weeks. 36 weeks, about maybe just a little above 8 months of pregnancy. So that's when you do not travel. At that point, you can fall into labor. You are close to delivery. So we don't want you to fall into labor while in the vehicle. But apart from that, except if it's stated by your doctor, possibly there's an underlying condition or you have some other reasons given by the doctor, you may. But in other case, otherwise, normal pregnancy, you can travel. All right, so the next one. Yes, no sex in pregnancy. Well, unless specified by your doctors, and then in some conditions, there's no education to sex in pregnancy, except if you are having possibly vaginal bleeding, if you're having abnormality of the cervix. The cervix is like it's the it's where the baby come out through. Is the is the end point of the vagina. It's the vagina continues to the cervix and to the outer wall. So if there's an abnormality in your cervix, there are some people they have cervical incompetence and so many other abnormalities like that. Or when you have drained, when the we call it is it your water has burst, something like that. Those are contraindications. Those are the times when you have sex. And the main reason is to prevent infection, especially when there's drainage of liquor. But otherwise, sex is completely safe in pregnancy, except possibly during the late trimester also, from around that 36 weeks also, to it might be just a little bit less comfortable for the woman. So thank you. Move on. All right. So now briefly we're talking about when to avoid pregnancy. When to avoid pregnancy. And the number one of the important reason is as a teenager. As a teenager, it is very pertinent that you avoid pregnancy. And possibly we may have teenagers around, or we may have no teenagers around. So it is important to avoid it. It's important because they do not have their hips are not formed enough, are not well matured enough to allow normal delivery, and it will cause increased morbidity in these people. They usually come with different complications, especially during delivery. And being a teenager means you are also a dependent. Do you understand? So as we move on, you see other reasons. But being a teenager means you are dependent on a family member, on your parents. So it's more of looking more of like a liability, a problem, than a thing of joy. So it is better to be prevented. So it's advised that completely avoid sex in this time. Um, Completely avoid sex at this time. So another time to avoid pregnancy is when you have underlying conditions like diabetes, mellitus, and hypertension. If you notice that your diabetes is not well controlled, it's better to avoid pregnancy at that time until you control it. So it is pertinent to go to the hospital so that it can be monitored and brought to good control. Because diabetes has a high risk of intrauterine death, means death even in pregnancy, death of the child, or we call it fetal demise, unexplained fetal demise. So it's common in people that have diabetes mellitus that are not well controlled. Then hypertension also, if your hypertension is poorly controlled, it might lead to many complications in pregnancy. So it's better to avoid it and control your BP, let be at a very good rate, good control before you plan towards pregnancy. And morbidly obesity, that's another indication to avoid pregnancy. Now, pregnancy, the normal we call it body mass index. That's the normal body weight. Body mass. Okay, maybe I may not be able to tell you how to calculate it, but body mass index is an index that is used to estimate whether you are obese or you are not. The normal body mass index is between 18 to 24.5. Okay, we can calculate it using your weight in kg over the height in meters square. The weight in kg over the height in meter square. Possibly we'll find an article explaining more about body mass index. So you can go and find out your weight and also find out your height, and then you make the calculation. Let me say it again. Your weight in kilogram divided by the height in meters square. So if peradventure you're about 60 kg and you have a height of 2 meters, so 2 meters times 2, that's 4, then 60 divided by 4, that's around 15. So that's just an example. So the normal body mass index is between, especially for pregnancy, is between 18 to 24.5. So if you are lesser than this or above this, especially for those that their BMI are as much as 30 kilogram per meter square, it's a no, please. You need to get on losing weight, finding a means to lose weight, because obesity, pregnancy has also causes a form of weight gain. Do you understand? These are one of the cases to avoid pregnancy. Another one, which is very important, is when it's not planned. And I used to say pregnancy is not an emergency, or let me say delivery is not an emergency. You understand? We've seen a lot of people, they come in and we are telling them, okay, you need to pay this, you need to get this, and they're like, I didn't plan this, I don't have money, blah, blah, all this kind of things. It is not an emergency, something that you have been seeing your wife, or you have been seeing the woman for the past at least 7 months, or maybe about 4 months. The stomach is looking at you, you are looking at the stomach, the abdomen, and you're telling me it's an emergency. No. So if you are not ready psychologically, financially, also covering the last part, which is extreme financial instability. If you are not ready psychologically, financially, please do not go ahead with pregnancy. It is very important. It is very, very important. Now, you need to understand that when you're pregnant, we are hoping for the best, but it is important that you also put in mind that there's a possibility that they might do a surgery. So if that possibility comes, what am I prepared for it? Do you understand? We are hoping for the good things, we are hoping for positive things, but we also need to make preparations. What if it ends up like this? Will I need to be running helter skelter? So please, when you do not plan for pregnancy, don't get pregnant. When you do not have enough financial stability, don't get pregnant. Try to avoid it. There are means of avoiding it, which I believe we will discuss in one of our articles. I think possibly this week or next week, we'll bring an article discussing how to avoid pregnancy. All right, so moving on to the next. All right, so let me briefly say one or two things about fears of pregnancy since we just talked about it. Now, there's so many people that are afraid, so many things has been said. You hear advice from your parents, from even grandparents, from friends, from colleagues, and this and that. And sometimes it makes you so worried. What are the things you can do not, to relay anxiety, to reduce fear in pregnancy? I mean, just list it briefly. It's not part of the slide. I don't want to take note of it and possibly make a note from it. So first of all, you need to ensure adequate sleep. As I've initially said, pregnancy is not a disease. You need to put that off your mind. Pregnancy is not abnormality. So first of all, you need to ensure you are getting enough sleep. Sleep well. Try and sleep well as much as 6 to 8 hours, if possible, per day. For a pregnant woman, it's very, very good. It helps to calm your nerves. It helps to calm your mind. Then another thing you can do is talk to your partner about it. Pregnancy is beautiful if you have a lot of support, you have a lot of a good, strong social system behind you. Talk to your partner about it. These are my worries, these are my fears. It's easier when you talk about these things. It makes it less dreadful. Do you understand? Another thing you can do is find a release. Find a release means how can you release this fear? There are several means to find a release. But one of the most important, one of the ones that I want to take note of is try to move your body, the position. Once you see that you are sitting down and you are anxious, change your position. Try taking a walk. Try taking a stroll. You understand? Try running, mild running. Try not so stressful running, but something mild, maybe around the compound. Try running or try whatever is interest, whatever activity you find interesting. Try doing those things. It takes your mind off the anxiety. Do you understand? So another thing you can do is journaling. Journaling. And let me tell you, it is important to write these things down, because since possibly this will not be your last pregnancy, it helps you to learn. Let me give you some interesting things that you can journal. You can journal the first fetal kick. The first time your baby kicked is a very interesting time that you can journal. So it usually happens between the 18th week to 24 weeks of pregnancy. So it's something you can anticipate for. It's something you can prepare for. Write it down. Okay, my first pregnancy, the baby kicked first on so day. This was is about 20 weeks there about then. That's the first thing. Then another thing you can do when you are anxious, possibly because maybe for some people that have had a previous miscarriage, and they're worried that will I have another one, this and this and that and that. You can do something else. You can monitor your kick fetal, we call it kick chart. You can make a kick chart. So let me quickly tell you about that. Kick charts, you're going to get a pen and you're going to get a biro, a pen and a book. I don't know if you know how to count Roman numeral. Counting 1, 2, 3, 4, and then you slash over the 4 to counting 4 strokes and a horizontal stroke to slash it. I don't know if you understand me. Do you understand Roman numeral counting with normal numeral? Anyone there? Do you understand it? Please
We're with you. You can go on. You can go on.
So now what you can do is you count 4 numerals and strike it. Once you're able to count 10 kicks in a day, that gives you an indication that your baby, at least a general indication that your baby is fine. So you can do that. It helps to squeeze your stress. You understand? You can possibly, maybe when you notice that, oh, this kick is less than 10 in a day, then you come to the hospital, you go visit the hospital so that they could see you. Another thing you can do is the movement of the baby. Check, is the baby moving? How fast, how much movement have you observed in the past, maybe past 2 days, 3 days? Have you noticed any reduction? So these are the things that you can possibly journal down, or you can fix your mind at. Then is get yourself knowledgeable. Read pregnancy. This is a beautiful source of knowledge about pregnancy. Know about the symptoms. So when you see these things, you know that, oh, this is what is happening. When you see this, oh, this is what is happening. But this is the caveat behind this. Please and please share your knowledge with your doctors. And so many people, they carry a lot of, let me not say garbage, but a lot of knowledge that are wrong, completely wrong. And they feel that's right, and then you realize that it is terribly bad. So whatever knowledge you got, just when you go for your antenatal visit, share your knowledge with your doctor. Oh, doctor, I had this. Oh, doctor, is this true? So they can clarify that. So let us move on to things that you do before pregnancy. I believe this will really help you to allay your anxiety in pregnancy. So what are the things you do before pregnancy? The first thing you should do is start taking folic acid. Folic acid is a form of vitamin that helps to prevent mortality in your baby. It's recommended that you take folic acid at least 1 month before pregnancy and as much as 3 months after pregnancy. So it helps to keep your baby, to prevent abnormality in your baby. You understand? So this 400 milligram of folic acid is enough. And there are so many drugs that contain this amount. We have pregnant care, we have preg mom, so many other things. So you can start taking folic acid before about a month before your pregnancy. So which will really, really help you. Then the second thing is start taking other vitamins. Take a lot of fruits, take a lot of vegetables. Also, those medications contains vitamins that are adequate enough. But I would advise that whichever one you're taking, show it to your doctor also, so that they can tell you that, oh, this is not there, this is there. So stop pose danger to pregnancy. There are so many activities that may increase your risk, or they may pose dangers. The first one is taking of alcohol, smoking, and those things. Strenuous activities that may pose danger. So you need to stop those activities before getting pregnant. All right. Another thing, can you hear me? My phone is.
Yes, I can hear you.
All right. Another thing you can do is budget for your baby. I think I've said that, so I'm not talking so much about it. As I've said, you should plan that. Oh, what if is the surgery needs to be done? Do I have the means to meet with this? So budget for your baby. Talk to your doctors. So it is important that you talk, especially for those that have a comorbidity. Some people, they may, for a sickle cell patient, you need to talk to your doctor. Medications that you use in pregnancy. So don't just assume and don't stop the medications. For someone that's hypertensive, you don't stop your medication because you're pregnant. Instead, you go to the doctors and they tell you, oh, this medication is not safe. Let us change it to this. This is not safe. Let us change this to this. So it's good to talk to your doctors before you get pregnant. Oh, doctor, these are the drugs I'm using. These are the conditions I'm treating. Can I go ahead with this? So talk to your doctors. So they can manage. All right, we move on. All right. So the symptoms of pregnancy, they are inexhaustible. So they are the first one on the list to tell you that you're pregnant. The first one, most common one that we see around is missed period. That is why it is important. I think last week we talked about the menstrual cycle on our article through it, how to calculate your, to know how to understand the menstrual cycle. So missed period is an indication that you might be, and others are headaches, spotting. Spotting may be because of, we call it implantation bleed. You know, the baby is trying to align himself to the womb of the mother. So because of that, there may be a slight bleed. And some people, they may take this bleed as menstruation, and it's usually cause some form of confusion last menstrual period, but we may talk about that briefly later. So nausea and vomiting, that's morning sickness, heartburn, tenderness, fatigue, frequent urination, raised body temperature, so many other symptoms like that. These are the signs you see that may give you an indication that you might. Once you are seeing these signs, you may report to the hospital, or you may go on a pregnancy test to confirm it. Once you have confirmed it, kindly report to the hospital. Can we move on? All right. I hope I'm not too fast. I want to give us a little time so that we could maybe ask some questions and there was some clarification. So another thing that may help with morning sickness is taking of pregnancy pops or peppermints. You know, they help to minimize nausea and vomiting. Can we move on? Then there's another one we know as pregnancy. Okay, before that, we talk about maternity clothes and underwear. Now, pregnancy is a season of your life. It's not the rest of your life, which you must understand. When you get to this season, you must understand that this is a season. Because it's funny that you are pregnant and you are still acting, you are not. Do you understand? I understand the aspect of, okay, possibly you don't want people to know, you want to continue your way of life, but pregnancy is a season, an important season that you must be aware and conscious of. It's this consciousness that helps you to adjust your clothing. So you should know that you change your clothing. Do you understand? It's one of the things you prepare for pregnancy. There are some clothing that you may not be comfortable in. Sorry, I have to take some. So get clothes that you'll be comfortable in, clothes that wouldn't be too tight. You understand? And get underwear too that will not be too tight for you. All right, the next slide. Then you get some pregnancy bands. Next slide, please. Yes, pregnancy pillows. So pregnancy pillows, they are foldable pillows. Look at, that's an example. Sorry, pregnancy pillows. That's an example there. It's foldable. You can get, not that expensive. It's around 15 to 25,000 in Nigeria. That's in Nigeria currency. And it's something that you can use again for your next pregnancy. You can keep it. So you can get it once and then keep it well for your next pregnancy. So it makes you very comfortable when sleeping. The other one are the pregnancy bands. The pregnancy bands are the form of they're like bands, or they're like belt like materials or tight materials that helps to um prevent back pain, prevent back pain. It also helps to carry the weight of your baby. Do you understand? And most for some people, it minimizes the that's abdominal protrusion, it helps to minimize it, but please don't let it be too tight. And so this may also help, especially for the back pain, the consistent back pain that comes with pregnancy, especially in the advanced. This may really help a lot. I will move on to just that. All right. So, what are the necessary requirements of a healthy pregnancy? First thing is eat your breakfast every day. It is very breakfast is said to be the most important meal of the day. So important to eat breakfast every day. Take high fiber diets. Diet that contains a lot of fiber, cereals, wheats, that. So take a lot of that so that it will prevent some symptoms, gastrointestinal symptoms that may complicate your pregnancy. If you have heartburn, you can eat small meal, spread it throughout the day. It also helps. Instead of taking large chunks of meal, eat smaller amount of meal, and don't eat late into the night. Since you know you are going to sleep, because after eating is not, you shouldn't sleep immediately. These things worsens heartburn. Do you understand? And then avoid raw or uncooked meals. At this stage, you should avoid raw foods as much as possible. Raw vegetables and so not fruits. I mean raw meals. Avoid those things as much as possible. Try to cook them and cook them well. Eggs, cook the eggs very well. Not have cooked eggs and other things like that. Take a lot of fruits and vegetables, then moderate intensity aerobic activities. So involve in activities. Some people say you should practice yoga with, I'm not sure. If you can, it's a good option. Exercises that makes your heart beat just a little bit faster. Do you understand? So you can take a walk at a faster pace, you understand? Not, but don't involve in exercise that does not allow you to breathe. There are some strenuous exercises that you have to pause and be breathing fast or taking or be gasping. No, those exercises are too strenuous in pregnancy. Exercises that just increases your heartbeat a little. Those exercises are good in pregnancy. All right, can we move on? As a person. So what are your responsibilities? Your responsibilities, the know your last menstrual period, especially the first day of the period. Now, this is of utmost importance. We've had a lot of, in fact, we usually have a lot of cases where they have problem with their expected date of delivery because they cannot remember their last menstrual period. It is very important to know your last menstrual period. This is why it is important to plan your pregnancy. When you decide that, okay, I want to get pregnant, at least the months preceding it, take note of your menstrual period. You just take a note and write it down. Oh, this is the first day I saw my menses, write it down. Because you don't know if you won't see the next. Right? Okay, so this is important because it helps us to estimate, it's a good estimation of your date of delivery. So many people come like that, and the doctors are just finding it difficult to get your date of delivery. And it may lead to some other forms of complications, preterm, that's delivery before time, and so many other things. So it's important to know your menstrual period, know the first day, your last menstrual period, know the first day you started menstruating. Then start your antenatal clinic visit early. I need you to understand that not every pregnancy their uniqueness. You were pregnant before, this is your third or fourth pregnancy, don't make you a guru in pregnancy. No, different pregnancies have their different uniqueness. I had a case that the person this was the fourth or fifth pregnancy. She said every other pregnancy normal. Do you understand? She went to the hospital, delivered, and went home. In fact, to my surprise, she didn't go to the hospital for I think one or two of the pregnancies, delivered at home, which was it came out fairly well, But this pregnancy she had, it was a lot of turmoil. She had to come to the hospital. Her blood pressure was skyrocketing. so many other things. So, if it's that she has assumed that, oh, well, I've had this kind of pregnancy before, why should I? It becomes a problem because she may develop complications at home and so many instances like that. There was one that she delivered normally. So she was shocked. She was like, this has never happened to me before. It's like, why is this pregnancy taking too long? Why is this taking too long? And this and that. We had to explain to her that, madam, because you have had more than 3-4 times in the past, does not mean it will be the same way every time. Do you understand? So start your antenatal visit early. Start within the first weeks of your visit. And it is important that you do an early scan. Early scan, well, there are different. I used to tell our patients, our women, that we requesting you to do scan is not because we want to, we're interested in your money or anything. There are a lot of things that we see in scan. The first trimester, there are things that we are looking out for. In the second trimester, there are things that we are looking out for. Third trimester, there are things that we are looking out for. Do you understand? So when we ask you to do scan, there are always reasons for that. So try and do your scan early. Your antenatal visit, let it be regular. We have made it quite easy. Once, in every 4 weeks, which is quite convenient. Once in every 4 weeks for your first 28 weeks of pregnancy. For your first 6 to 7 months, you come just once in a month, which is fine. Do you understand? Then moving on to 28 to 36 weeks, you come every 2 weeks. And then from 36 weeks to your delivery, you come every week. So these are the normal antenatal clinic visit, but this may not be so for every pregnancy. As I've said, every pregnancy has its uniqueness, and then some people may have some other conditions that will require that they come more frequently. Do you understand? So, but basically, these are the normal routine antenatal visits. So if you are going to be counting it, that's about how many visits? About max of 10 to 12 visits in a pregnancy, which is still fair enough. Out of 9 months, out of almost how many days? You are coming to the hospital just 12 to 13 times, which is still fine. Now, your first antenatal visit, you may need to run some investigations. I may just run through it. You may need to do a urine test. They'll take your urine test. They'll do they want to check your genotype. They want to check your blood group. Do you understand? We are interested in knowing these things just for your delivery and the normal pregnancy. Want to check your blood pressure. Want to check your weight. Want to check your height. Want to check your viral. We call it viral markers. Want to know your your state, whether you have any condition that we need to watch out for. Do you understand? So these are routine investigations that you need to do in your antenatal period. Now, ensure early scan, as I've earlier said before, do not take any medication without your doctor's prescription. This is not the time for you to be going to one quack here and there, one woman, one person. In fact, it's not advisable to get medications from someone that has been previously pregnant and they say, oh, you're feeling this way, and I felt this way too, so take this drug. No, don't do that. Do you understand? Because she may not be giving you the full story. And you yourself, your story, you may not be able to give her the full story. There are some things that will say, no, don't take this. Okay, this person took it, but it's not right for you. So do not take any medication without the doctor's prescription. Then completely avoid herbs. There's a case that we had that the person, it was quite, it was quite contradicting, but long and short, she took some herbs and it was so serious. We had to struggle with the patient so much, because of the herbs she took. Do you understand? So please try to avoid taking herbs, avoid smoking and cigarette altogether. All right. Next, I think that brings us to the end of this webinar this moment. So I believe we have learned one or two things. In the next, I will be taking you through a journey. We're talking about the different trimesters and what to expect. We're taking you through a journey. I will be acting like a guide through your pregnancy journey, and then we'll be talking about delivery, post-delivery, and then we'll be allaying your fears of cesarean section. Thank you very much. Thanks for listening. All right, so I'll be taking in questions or any form of clarification. Thank you. Once again.
Yeah, thank you so much, Dr. Yomi. So if you have questions or you need clarification, you can signify. You can unmute yourself and ask your question, or you can drop your question on the chat function. Then I'll read out your question. So while you get your questions together, I would like to talk about Aspramed. Like I said earlier, Aspramed is a social enterprise existing to support healthcare system in Africa. Like I said, the parent company is in Australia, and our goal is to provide quality, accessible, and affordable healthcare system for people in Africa. So do you have questions? If you have questions, you can unmute yourself to ask the question. I'll send, you can unmute yourself if you need to ask question, or you can drop your question in the chat function. Okay, let me go on. So basically, what we offer is a mobile application. So if you go on your Play Store or you go on the Apple Store and you search for Aspramed spelled SAPRAMED, you're going to find the app and you can download it. You have access to over 40 doctors if you need to speak with any doctors. And if you need to speak with Dr. Yomi, you have access to him right on the app. So I don't know if anybody have questions. I'd like to take questions about what we've discussed so that Dr. Yomi can give answers to your question. You can use the chat function to also ask your question if you have any question. Okay, Dr. Yomi, can you see the question? Dr. Yomi, are you there?
Yes, I'm here. Let me check the question.
Okay. How can you take care of, I don't know how to pronounce this.
Glycosuria.
Okay. In pregnancy, how can you take care of glycosuria in pregnancy, and what are the steps before conceiving? That's from Zainab Saba. Dr. Yomi, the floor, you can answer, please.
All right, thank you very much. Glycosuria basically is when there's glucose in your urine, when you're eliminating glucose in your urine. Now, for the early phases of pregnancy, glycosuria might be normal. Do you understand? For the early phase of pregnancy, but seeing glucose in your urine might be an indication that the pregnancy may be tilted towards a form of glucose abnormality, possibly a form of diabetes. So seeing a glucose in your urine, it is important that you go ahead to do some other tests. We need to check the sugar in your blood to know the quantity or the extent of the sugar in your blood. So once we see that, okay, the sugar in your blood is abnormal, then we can place you may need to start medications on medications for diabetics. Do you understand my point? But if you see glycosuria and we run a test, a sugar test, and there is no, your sugar, in the blood is not so much, it's not above the normal value, then it may just be a slight form of it may just be normal for that pregnancy. I don't know if you understand. So if glycosuria is present and then doing a sugar test it's showing that there's a high level of sugar, then you need to see a doctor because you need to be treated for either gestational diabetics or possibly you had diabetics in the past and you didn't know. Do you understand? So they'll place you on some medications and then they'll do some follow-ups for you. So that is what you need to do. Thank you very much.
No, Dr. Yomi, there's a follow-up question. What are the right steps before conceiving? I
Okay,
think you
so
mentioned it earlier.
yeah, so if you notice there's glycosuria, no, now if there's glycosuria before pregnancy, it's quite different from glycosuria in pregnancy. As I initially said, glycosuria in pregnancy, if it is mild, it may be normal in pregnancy. But if you are having glycosuria before pregnancy, though it means you need to is like an alarm sign for you to check your blood. So it follows the same pattern. Once there's sugar in your urine, go to the hospital, let them check the sugar in your blood. The sugar in your blood is the more it's better accepted. Let me use that word to define whether you have diabetes or not. So if you have, then they will also start treatments to control the sugar before you get pregnant. All right. So that's it. So the drugs will be adjusted. There are some drugs that you can use in diabetes normally, but may be contraindicated in pregnancy. So that's the more reason why once you see this sign, you need to see a doctor that will tell you, okay, these are the steps that you need to take. These are the drugs we need to start you on. These are the drugs you need to avoid. Thank you.
Yeah, thank you so much, Dr. Yomi. Do we have any other question from any other participants? Or do you have a comment or an observation you want to raise? We have about less than 10 minutes to end this webinar. I would like to know if we have questions. Mm, I'm not sure if people have
If you
questions
have
now.
If they have any particular aspect that they want us to talk about also in the next webinar session, I think you can also feel free to raise such so that we can take note of it and talk about it. If possible, we cannot talk about it extensively here, then we'll talk about it in the next webinar session.
Okay, great. So if there's any other thing you would like us to talk about in the next webinar, you can also suggest it so that we can also put that in mind. Okay, there's a suggestion said we should discuss allergy and asthma in newborn. Okay, we'll take note of that. Thank you, Zainab, for that. We'll take note of that and we'll work on that. So there's a question. How is it possible? Okay, oh, we have more questions coming in now. Okay, so there's this question. How is it possible that one have sexual intercourse during ovulation and not get pregnant? Dr. Yomi, how is it possible that one have sexual intercourse during ovulation and not get pregnant?
Well,
Then, okay, you can go on. Then I'll ask the next question. You can go on.
all right. Well, ovulation is the time where you have a very high chance of getting pregnant. So if you are ovulating, which you have confirmed, possibly through running some investigations and your normal body symptoms in ovulation, and you are not getting pregnant. So there may be other causes for that, and it's broadly under possibly. It may just possibly mean that the sperm or the semen is not adequate enough. Do you understand? Because as we know, the sperm can stay for about 3 days, maximum of 72 hours, 3 to even 5 days in a woman before, and within that period, it can fertilize an ovum and cause pregnancy. So if this is not happening, even during, because if sex happens during ovulation, it means you have a period of 3 to 4 days there about after ovulation to get pregnant. So if this is not happening, it may mean a lot of things, possibly that there's an abnormality in the sperm. So there may be an abnormality of the motility, abnormality of the number. The number of sperm running may not be enough. The motility may not be strong enough. Do you understand? And so many other abnormalities. Also, there may be a problem with from the woman's side. Possibly the sperms are not even getting to the right place they ought to get to cause fertilization. Possibly the woman has some forms of infection or anything that may stand as a blockage towards that pathway. So this might also prevent fertilization even while in ovulation. So there are many other causes that we may need to begin to start finding out. But one of the most important one is possibly the sperm is not adequate, or possibly the environment is not conducive enough for the sperm to cause fertilization. And I've given an example of environment that may not be conducive in a woman that may have pelvic inflammatory diseases, in women that there are some women that may possibly the acidity or the of the vaginal may be too strong for the semen to live or for the semen to be functional. So there are so many other causes, but these are the major causes of, and then even apart from, after fertilization, there are so many other things that may even prevent, yes, that may even prevent implantation and even prevent pregnancy from progressing. So it's something to really look into, but these are the common things that might cause it. All right, thank you very much for that question.
Yeah, there's another question here. It says, it said, I've been trying to conceive for the past 2 years now. What test do I need to do to conceive? Then I ovulate regularly and my period is accurate. So the person is trying to conceive for 2 years now, and if she's asking what test will she
All
have
right.
to do?
Uh, all right. Thank you very much. That is a broad topic which is under infertility. Do you understand? So, this question may not be extensively answered here because, as I've said, is a broad topic which might really need to involve further questionings and further investigation. Before even going to investigations, there are some questions that may need to be answered first. But it is best if you see a gynecologist, but possibly book an appointment so that we can talk more about that. So causes of infertility may be categorized into the male causes. Yes, men can also cause infertility. As yes, it's a myth. They think it's just women, but really, close to 40%, even 40 to close to 50%. Let's say about 40% of infertility is caused by the men. Do you understand? While some are caused, about 40 to 50 also caused by the women, while about 10% is unknown. Do you understand? So it's a very broad topic. It may come from, but I won't advise you to go for any investigation. It's better to have a one-on-one chat or discussion so they can possibly rule out every other causes that can be dealt with before going in for the investigation. Do you understand? Because as I've said, it's not only you that will do the investigation, you may also need your husband to also be checked, to also do some investigations and other things like that. So I think it's better you book a form of appointment or you go to see a gynecologist. That way we can really sit down and do some, questioning and other investigations too. Thank you very much.
Yeah. Thank you so much, Dr. Yomi. Like I said earlier, this program is sponsored and supported by Aspramed Nigeria Limited. It's a telemedicine app. So if you want to know more or you want to use our service, you go to Google Play Store or Apple Store to download the Aspramed app. And when you download the app, you register, you're going to find over 40 doctors, and you obviously find Dr. Yomi too on the application. So how do I connect with you, sir? Okay, if you need to connect with Dr. Yomi, apart from being able to connect with him via the app, there's a number that will be showing on your screen now that gives you direct access to Aspramed. So, or you can visit the website at www.aspramed.com. You can equally send an email to support@aspramed.com, and you can call, you can WhatsApp most likely, or call the Nigerian number. And for those people that are outside the country, you can equally call the Australian number. So I believe that answers the question that how do you connect with Dr. Yomi after this webinar? You can, like I said, you can simply go to www.aspramed.com, or you visit, or you use any of the phone numbers that we're showing, or you can send an email to support@aspramed.com. Thank you so much for joining this webinar, and we'll hope to see you in the next webinar next month. Next month, we'll be focusing on, apart from the suggestion from Zainab Sabah, who wants us to talk about allergies and asthma in newborns. So we'll be talking about the different trimester and what you expect in each trimester, and a guide through the journey of pregnancy, then delivery, post-delivery, and allaying fears on cesarean session. Thank you so much. For everyone that registered, you're going to get an email for the next webinar, and we hope you will join the next webinar. Thank you for joining today, and we wish you all the best, and we hope you and your family, you stay healthy and you stay safe. Thank you very much for joining us tonight. Have a wonderful evening.
Everybody. Okay.